Welcome back to Doctor Saying Stuff.
To set the record straight, we brought on an expert to talk to us all about childbirth.
In childbirth or labor, there are 3 stages that are noted. The first stage is when your cervix is dilating, so you're going from a closed cervix to an open cervix, and we consider fully dilated 10 centimeters. The second stage is the actual birthing part that people think about. So that's the part where you're pushing the baby out if this is a vaginal delivery. The third stage is when the placenta is delivered. So it's after the baby's born and the placenta is what's left in the body and left in the uterus. So there are some conditions that can happen very quickly. And that's part of the reason why childbirth can be dangerous. So things like bleeding can happen. And by bleeding, I mean very heavy bleeding or hemorrhaging. Additionally, blood clots are way more common around pregnancy and immediately after childbirth. There is a higher risk of having life-threatening blood clots that can travel up into the lungs and can cause major issues. The key to it is really being keen on identifying risk factors, and then monitoring things closely with the pregnant person and making sure that if there are any concerning warning signs that you address them in order to avoid the worst happening. Things like access to proper health care, access to proper food and healthy food items, access to education, even environmental causes. And by acknowledging the link between poor outcomes and social determinants of health and access to care, I think allows for better holistic solutions to this.
Dr. Irobunda, thank you so much for joining our show today. We really appreciate you being here.
We'll be back with more women's health and reproductive health, so stay tuned. We are Doctors Saying Stuff.